Chapter 4, Drug Interactions and Medication Errors. Drug effects are influenced by concurrent administration with foods and other drugs. The more drugs that are administered to a patient, the more likely it is that interactions will occur. Drug-drug interactions and drug-food interactions can increase or decrease the attended drug effects. They may also increase or decrease the drug side effects. Drug interactions may produce life-threatening or minor undesired effects, or they may enhance the desired drug effect. The study of pharmacology is important because it enables the prediction of the likelihood that a drug interaction may occur. An interaction that occurs between two or more drugs administered at the same time is called a drug-drug interaction. Drug-drug interactions may increase or decrease the effect or side effect of a drug. Tetracycline and penicillin both treat infections. If the drugs are administered together, the infection fighting ability of penicillin is reduced by the tetracycline. The antifungal action of ketoconazole is reduced if the drug is taken with antacids. Anti-ulcer drugs such as cimetidine increase the effects of alcohol, and amoxicillin reduces the effectiveness of oral contraceptives. So all antibiotics do reduce the effectiveness, but amoxicillin tends to be like the number one that I see mentioned and kind of worried about out in the field. Foods may contain enzymes, vitamins, or minerals that enhance or interfere with drug effects. An interaction between an administered drug and food consumed at the same time is called a drug-food interaction. A classic example is an interaction between dairy products and the anti-infective tetracycline, so the antibiotic tetracycline, which binds with the calcium in milk or cheese, which decreases the drug's effectiveness. Additive effects may occur when two drugs are administered concurrently. The increased effect is equal to the sum of the individual effects produced by each of the drugs alone. Many drug interactions produce additive effects. The sleeping pill temazepam is administered to promote drowsiness. Alcoholic beverages also cause drowsiness. When alcoholic beverages are consumed together with temazepam, additional drowsiness is caused. The sedation caused by temazepam adds to the sedation caused by alcohol. Drug-drug interactions and drug-food interactions may produce synergistic effects. Synergistic effects result when two drugs administered together produce effects that are greater than would be produced if either drug were administered alone or would be seen with additive effects. So the additive effects can be described using this equation. So 1 + 1 = 2. However, with synergistic effects, 1 + 1 actually equals 3. So you can see the difference there. The process whereby one drug or food increases the effects of another drug, yet does not produce any effect when administered alone, is called potentiation. Potentiation can be described using the equation. So 1 + 0 = 2. Antagonism is a drug-drug interaction or drug-food interaction that blocks drug effects. Naloxone is administered to block the respiratory depression produced by opioids like fentanyl, morphine, or heroin. Antagonism can be described using the following equation: 1 + 1 = 0. And just a little side note, grapefruit juice is implicated in many drug-food interactions, which you will see throughout this mod and throughout your time in the program. Grapefruit juice actually interacts with a lot of medications. Drug-drug interactions and drug-food interactions occur via many different mechanisms. Co-administration of drugs or drugs with food can increase absorption, distribution, metabolism, or elimination, and result in increased or decreased drug action or side effects. All right, so table 4.1, we have the summary of selected drug and food interactions. This is a really nice table to kind of just see some of the major side effects. So we talked earlier about the drug tetracycline. So if that is taken with penicillin, the effects or side effects are decreased, meaning it's not going to work as good as it would if it was taken alone. Also with antacids and also with dairy products. Ketoconazole also has the effects or side effects decreased by antacids. And alcoholic beverages, the effects or side effects are increased by the medication cimetidine. So this is just a medication for heartburn or indigestion. And if you take that with alcohol, the effects of the alcohol are going to be increased. So that means you're going to, even if you only had one drink, for instance, you are going to feel way more intoxicated than you would if you weren't taking cimetidine. So that's kind of important to remember. And also cimetidine is over the counter. So if you think about how many people this could affect, really, it's kind of interesting. And something that, I didn't know until I was working in the pharmacy. And how would you know? I mean, I'm not even sure I'm sure if we read the back of the thing, it would say the back of the medication over the counter, it probably would say, avoid alcoholic beverages, but pretty much every medication does. So I just wonder how many people that this has affected. Again, oral contraceptives, the effects of those can be decreased with amoxicillin or really any antibiotic. Levothyroxine is reduced. The effects are reduced when taken with iron supplements. Triazolam, the effects are increased with alcoholic beverages. And that medication is a medication that can cause drowsiness. So those are going to be increased with alcohol. Warfarin, the side effects are increased by NSAIDs like aspirin or ibuprofen, but the side effects can be decreased by vitamin K. Vitamin K is the antidote for a warfarin overdose. Levodopa is increased by carbidopa, which is why they are together in a medication. Verapamil is increased by grapefruit juice. Griseofluven is increased by fatty foods. Morphine, the effects can be decreased by naloxone, which is why we give naloxone for opioid overdoses. The effects of lidocaine can be increased with epinephrine. Cimetidine can also be, the effects could be decreased by antacids. Phenobarbital, phentoin, and sodium bicarbonate can decrease the effects. And then penicillin, probenecid can increase those effects. Drug disease contraindications can be avoided by maintaining an up-to-date patient history of chronic and acute medical conditions. Information about prescriptions filled at other pharmacies should be obtained if possible and entered in the pharmacy's computer system. And that can just basically be whatever the patient's taking at home. When asking a patient their medication history, always ask, are you taking any over-the-counter medications? Are you taking any herbal supplements or vitamins? What other prescription drugs are you taking? The National Coordinating Council for Medication Error Reporting and Prevention defines a medication error as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Medication errors that are made by healthcare providers in hospital and ambulatory care settings account for 70% of the medication errors that can potentially result in adverse effects to patients. Miscommunication of the drug ordered may involve poor handwriting, confusion between drugs with similar names, misuse of zeros and decimal points, confusion of metric and other dosing units, or inappropriate abbreviations. Many jokes have been made about physicians' poor handwriting. However, medication errors that are made because prescriptions were not decipherable are no laughing matter. When prescriptions are illegible, there may be confusion between drugs with similar names. Electronic prescribing has been shown to eliminate medication errors caused by illegible handwriting and result in a 7-fold decrease in overall medication errors compared with handwritten prescriptions. So that is really kind of a nice thing now that it is out there. Electronic prescribing, e-scribing. When I first started in pharmacy, that really was just starting out. So not every prescription was sent that way, but now most are. Table 4.2 shows you selected FDA ISMP in the joint list of confused drug names. So you have over here the drug name and then what it's confused with. Quite a bit, so we won't go through all of those, but you can read them and you can also visit those websites if you have any more questions. Orders for medication may be incorrect because the strength is written incorrectly or illegible. Haloperidol is a drug used to treat schizophrenia. It is available as a 0.5 milligram tablet and as a 5 milligram tablet. If the decimal point to the left is illegible or the 0 is omitted, there may be confusion about which strength to dispense. On the other hand, if the 5 milligram tablet was ordered and the prescription was written as 5.0 milligrams, it could be confused with 50 milligrams. In both cases, if the error is not caught, the patient receives 10 times the desired dose. So to avoid med errors, we always place a 0 in front of the decimal when calculating and recording doses that are less than 1 ml or 1 milligram. And I will usually correct you on that as soon as I see it. That's a big no-no. Prescriptions may be written using metric units or apothecary units. Medication errors have been caused by improper conversion between the two systems of measurement. So you will learn more about this in the math mod, or if you've already taken it, you should know a little bit about this. Medication errors made by prescribers may also occur because of lack of information or misinformation. Limited information about the patient occurs when no medical or drug history was taken or insufficient information was collected from the patient. Studies have shown that more than 25% of the prescribing errors made in hospitals are associated with incomplete medication histories being obtained at the time of admission. A complete history is needed of patients' allergies, other medications they're taking, previous diagnosis, and laboratory results to prevent medication errors. An error of omission occurs when information is not collected or recorded in the patient's medical history. Studies have shown a 67% error rate in obtaining prescription medication histories. Medication histories taken by physicians were less accurate than histories taken by pharmacists. An incomplete drug history may be cause for prescribing a drug similar to one that is already being administered. This is called therapeutic duplication. Therapeutic duplication may increase or decrease desired side effects. If both drugs compete for the same drug receptor binding sites or the same transport systems, the drug with the greatest affinity will bind. Omission of drug allergy information could result in a prescription written and filled for a medication that may cause extreme harm to the patient. Prescriptions written for drugs that are contraindicated often occur because of patient's disease state or allergies not being recorded in their patient profile. Pharmacy technicians may encounter the abbreviations NKDA for no known drug allergies or NDA for no drug allergies. Also, NKA, no known allergies. Commission errors result when a previously discontinued drug is accidentally restarted or a non-prescribed drug is accidentally added to the patient's medication history. This can occur when inaccurate drug histories are collected from caregivers or from patient confusion. When this occurs, unneeded drugs are taken and the patient is at risk for more adverse reactions. Pharmacists, pharmacy technicians, and pharmacy assistants make preventable medication errors too. Medication errors made by pharmacy personnel usually involve transcribing errors, incorrect interpretation or prescription contents, improper product preparation, lack of prescription monitoring, product labeling, and incorrect dispensing. Some dispensing errors are caused by distractions in the pharmacy. The pharmacist or pharmacy technician filling a med order may become distracted when his or her workflow is interrupted by the phone ringing or by questions from a patient at the pharmacy counter. Serious medication errors have been caused by confusing abbreviation. This problem is so serious that the Joint Commission and the National Coordinating Council for Medication Error Reporting and Prevention have recommended abolishment of the use of certain abbreviations. So these are here on table 4.3. So you can see what they do not want you to use, the potential problem, and use instead. This list kind of always makes me chuckle because yes, I get that that's recommended, but most doctors are not going to do that. So they will never be abolished. Poor handwriting is responsible for many transcription errors, like we've kind of talked about. Medication orders received by the pharmacy must be translated and entered into the computer. If the order is ineligible, the pharmacy must verify the order to prevent incorrect selection of the drug and strength ordered. Medication orders received by phone or left on a computer messaging system are also subject to transcription errors. Verbal medication orders must be written down accurately, or medication errors may result. Medication errors occur when a pharmacy fails to carefully monitor drug therapy. An important role of the pharmacist is to monitor the appropriateness of drug therapy. Pharmacy technicians assist the pharmacist with this task. Another medication error made by pharmacy staff is improper sterile and non-sterile compounding. Medications for parenteral administration must be administered using a aseptic technique. Medication errors associated with incorrect calculations can also occur. Combining incompatible drugs is another source of errors. Several medication errors involve improper labeling of drugs to be dispensed. A labeling error has occurred when the correct drug is selected, but the container is labeled with the wrong drug name, dosage form, strength, or quantity. Putting the wrong patient's name on the label is another labeling error. Incorrect or incomplete directions typed on the label are other preventable label errors. Selection of the wrong drug to dispense is a preventable error. This type of error most often occurs when drugs have similar names or similar packaging. Other product selection errors include dispensing the wrong strength or wrong dosage form. Placing the correct prescription in the wrong patient's bag is a bagging error. Placing additional prescriptions into a patient's bag or omitting a prescription from the bag are also bagging errors. And when working in retail, that is actually a very common mistake. So if the pharmacist does the bagging, I've caught pharmacists placing the wrong prescription and the wrong name or vice versa. And I've also worked at a place where the technicians did the bagging. And again, that also happens. It can happen with anybody. A properly filled prescription that is dispensed to the wrong patient is also a medication error. This may occur when two customers have similar names. The pharmacy staff may incorrectly hear the name of the person who wants to pick up his or her prescription. The patient may incorrectly hear the name of the person the pharmacy staff has announced. This error is preventable. Always verify the name and identification of the person picking up the prescription. Medication errors are made by healthcare providers and caregivers who administer medication. One error associated with drug administration can result in a drug being given to the wrong patient. Sometimes the correct drug is given to the right patient. However, the drug strength, dosing frequency, and dosage form are incorrect. This is also a medication error. Medication errors are made by patients too. Pharmacists, pharmacy technicians, and other healthcare providers can help patients prevent medication errors. Patients are often confused by generic and trade names. Their medications may be labeled using the generic name in the hospital. The community pharmacy may label the same drug with the brand name. The patient may not realize the drugs are the same and take a double dose. A similar situation occurs when two similar medications are prescribed by different physicians. The patient is unaware that taking both medications is therapeutic duplication. Confusion is one reason why patients refill medications that have been discontinued by their healthcare provider. Two other medication errors are important to note. They are taking too much medication and two, taking too little. Sometimes patients believe the saying, if one pill is good, then two pills are better. Others do not realize the importance of taking medications without missing doses. They do not realize that a chronic illness becomes worse or drug resistance can develop when doses are skipped. For some patients, the medication is too expensive and they take less than the prescribed dose to try to stretch the prescription and make it last longer. Regardless of the reason, taking too little or too much medication can negatively influence drug therapy outcomes. Pharmacy technicians can play an important role in preventing medication errors. Some tips for preventing medication errors are, so always verify prescriptions with similar drug names, always verify unfamiliar abbreviations or abbreviations published in the Joint Commission's do not use list, avoid product selection errors by using the pulled dispense review system. Become familiar with the brand and generic names of commonly dispensed drugs. That's a huge one. Become familiar with the strengths, dosage forms, and dosage frequency of commonly dispensed drugs. Another huge one. Alert the pharmacist of all drug interactions and therapeutic duplications. Develop a routine to avoid errors associated with distractions. Check the identification of each person picking up prescriptions. Dispense patient information sheets as required and affix warning labels to prescription vials as required. Verify all calculations and check all labels for accuracy.